pretty much telehealth is used in all different forms of healthcare. So I just picked out a few random examples here. So in ophthalmology, there's the use of both real-time and store and forward telehealth. And as Sue said, real-time is synchronous, and store and forward is where you capture some data and you send it to be looked at later. So in ophthalmology, you can use real-time video. So you can connect your video camera to your slit lamp, and you can have someone in a rural area that's got an eye injury, and you can video to an ophthalmologist and get practical advice on what to do next. Or an example of store and forward is to use a retinal or a fundal camera. So with a fundal camera, you can do screening for diabetic retinopathy, and then you send the photos into a central bank of ophthalmologists who then read the photos and send a report back. So it's a bit like turning one aspect of ophthalmology into more of a diagnosis and report. So it's a bit like radiology, you know, diagnosis and report. Not all of ophthalmology, but just this one aspect. And they're doing a lot of that in Western Australia at the moment. In fact, they're screening all the prison population of Western Australia. They've got about 12 prisons, and they go around every year and take fundal pictures because the prisoners have a very high rate of diabetes and blindness as well, you know. And they're doing that, and there's moves to increase that, you know, and do that in Aboriginal communities, rural areas, high-risk populations. So that's ophthalmology. Mental health, it's mostly real-time video. So psychiatry assessments, also delivering treatment, so cognitive behaviour therapy and things like that via video. Dermatology, again, the use of photographs is getting bigger and bigger. Also, there's perhaps mostly dermatology is done with still images, but you can do real-time as well. So we ran a real-time teledermatology service to Darwin for 12 months a couple of years back, because Darwin didn't have a resident dermatologist, and the dermatologist that went up there every 6 to 8 weeks was just finding that she went up there for 3 days and she was just overwhelmed with work. So we set up a weekly video consulting so that she could see all her follow-ups. She still saw the new people in person when she went up there, but she did all the follow-ups by video, and that cut down the workload when she was up there. She was able to spend more time with new patients and less time having to follow everyone up.